In this video, I will present the pharmacological actions, clinical indications, and adverse effects of bile acid sequestrants. Bile acid sequestrants are medicines that help lower LDL cholesterol. These medicines include cholestyramine, colesevelam, and colestipol. They block bile acid in the gastrointestinal tract from being absorbed into the blood, and thus preventing the reuse of bile acids. So, what are bile acids? Bile acids are kind of like digestive juice. They are primarily made from cholesterol in the liver, and stored in the gallbladder. When we eat a meal that contains even a small amount of fat, it signals the gallbladder to release bile, which flows through a small tube into the duodenum. The function of the bile acids is to help digestion and absorption of fats. Almost all of the bile acids are absorbed in the terminal ileum to the portal circulation, and return to the liver to be reused. More than 95% of bile acids are recycled and reused. The remaining bile acids are excreted in the feces. This amount is balanced by the synthesis of bile acids from cholesterol in the liver cells. Bile acid sequestrants are large molecules, and they are not absorbed from the gut. The bile acid sequestrants do is, they bind bile acids in the gut. They sequester or hide the bile acids from being absorbed into portal circulation. By doing so, any bile acids bound to the drug are excreted via the feces. The liver cells produce more bile acids from cholesterol, to replace those that have been lost. They can synthesize cholesterol from acetyl-CoA, through mevalonate pathway, and also picks up cholesterol from the bloodstream through LDL receptors, thus lowering LDL cholesterol level. Bile acid sequestrants are usually added to a statin therapy. They work in different ways, as statins block cholesterol production in the liver. The combination further decreases LDL cholesterol. Commonly used bile acid sequestrants are cholestyramine, colesevelam, and colestipol. They are used to treat hypercholesterolemia, reserved for patients unable to take statins, or who require additional LDL cholesterol reduction, as statins are the most potent drugs and well tolerated in most patients. Addition of a bile sequestrant to a statin produces additional LDL cholesterol reduction. They are also used as a second-line treatment for pruritus associated with partial biliary obstruction. Cholestyramine comes as powder with doses measured by the scoopful, or in individual dose packets. Each packet contains 4 grams. It is initially given 1 to 2 packets once a day or in divided doses, usually before a meal or at bedtime. The dosage can be gradually increased over 1-month interval, and maximal dose should not exceed 24 grams per day. As it is a chalky powder, it must be taken with lots of fluid. Elder patients or even young patients may choke on swallowing those powder. It is important to note that other medications should be taken at least 1 hour before, or 4 hours after cholestyramine, as it can interfere the absorption of other medications. The next is colesevelam. It comes as 625 mg tablet, or packet containing 3.75 grams of colesevelam powder. It is given 3.75 grams or 6 tablets once daily, or in divided doses. The size of the tablet is large, so it may be problematic for patients who have a swallowing problem. The powder type should be taken with lots of water. The last one is colestipol. It comes as 1 gram tablet, or packet containing 5 grams granules. For tablet type, it is given 2 grams once or twice a day initially, and can increase up to 16 grams in divided doses. For packets, it is initially given 5 grams once or twice a day, and can increase up to 30 grams in divided doses. Just like other bile acid sequestrants, The dose must be increased gradually, over 1-month interval. It should be taken with lots of fluid. Since bile acid sequestrants are not absorbed in the gastrointestinal tract, they have limited systemic side effects. The most common side effect is constipation, as they are not absorbed and sticky in the gut. Increasing fluid intake and high-fiber diet helps to relieve constipation. They can also cause gastrointestinal upsets, such as abdominal pain, bloating and nausea. They can interfere absorption of other medications and fat-soluble vitamins, when taken together. As far as contraindications go, bile acid sequestrants should not be used in patients with complete biliary obstruction, where bile is not secreted into the gut. They are not suitable for patients with hypertriglyceridemia, as they may increase triglyceride levels in the blood. I hope you enjoy this video. Thank you for watching this video. Stay safe and healthy.